Okay, so we are back with another set of videos. This week we're going to be doing our newborn assessment. I'm going to be doing my APGAR scores. I'm going to go over newborn reflexes. I'm going to administer some vitamin K and erythromycin ointment to my little baby here, and then we're going to collect some urine. So I'm going to go newborn assessment. And then actually I should have probably done the urine because I'll have to tape my diaper back on my little baby here. So this is my little baby. Okay, he's got his arm bracelet on. Well, because it's gonna be a girl. She's got her arm bracelet on. I'm gonna show, this is my poster that I made here for my newborn assessment. I'll take a picture and insert the picture as well. So starting out with my newborn assessment, I would use the same safety precautions as when performing an adult assessment. So I would perform my kiwis, wash my hands the same exact way. First off, I'm going to do an overall assessment looking at my patient. So I'm going to assess the skin of my patient. And this is where APGAR comes into play, but I'll do another video for APGAR. This is where I would assess my APGAR scores. That would be the first thing that I do with my patient. Actually, turn this way so you can see more of my little baby here. Okay, so I would do their vital signs. So I'm going to check their temperature, their pulse. I'm going to do their blood pressure. I'm going to do all of those things that I would do for a normal set of vital signs. I would do the weight of the patient, measure the length of the baby, assess their muscle tone and their strength. And then for my head to toe portion of it, I would start at the patient's head. So I'm just going to sit it up to face the camera. I know I would not be sitting a one-day-old baby up like this. But I'm going to start at the head of the patient. So I'm going to assess the head of the patient. I'm going to assess the shape of the head, the anterior fontanelle. I'm going to assess the symmetry of the face and the eyes to the patient's head. Typically, babies' heads are much, much bigger than their body. So it's not unusual for the baby's head to be overly large. I'm going to move on down to the eyes of my baby. I'm going to assess for reflexes of my eyes. I would use my pen light. I can use my pen light for this, but you don't want to always shine light in baby's eyes. I would assess for any cataracts and any jaundice. I would assess the ears of my patient. I would assess the ears, the placement, the position of the patient in ratio to the head. And because I know the ears form at about the same rate as the kidneys, to make sure that the ears are fully formed and in the correct position and the shape of the ears. Moving on down again, I'm going to assess the mouth of my patient. I'm going to open it up and look at their palate. Okay, and I would open it, see if they have any signs of cleft palate or a cleft lip. I would assess for any cyanosis or any neonatal teeth. Moving on down, I'm going to assess the neck of my patient. So I'm just going to palpate the neck of my patient. And again, I'm assessing the skin and the color of my infant. Moving on down to my extremities, I'm going to assess all extremities, including the arms and the legs, to see if they have any extra digits, if they have any extra fingers and toes, if there's any webbing in between the fingers and the toes. And there's not. I'm going to go ahead and look at the toes now while I'm doing the extremities. We're going to assess for any webbing, any extra fingers, toes, and there's no signs of that. Okay, so I'm going to go back to my chest area to where I would also listen to my lung sounds of my patient. Again, I'm going to be assessing my patient's chest for symmetry. So I'm going to turn this way and assess my lung sounds, making sure there's some chest movement there. And the respiratory rate, and see if there's any signs of distress. Okay. And I would listen for about a minute. I know in assessing lung sounds, I'm going to go left to right, or right to left, whichever way I go. Oops, my stethoscope came apart. Ouch, that hurt my ear. Okay. So now that I've done my lung sounds, I can also go ahead and do my heart sounds as well, assessing for the rate and the rhythm, seeing if I have any murmurs. Okay. And that is all good and normal. Okay, so now I'm going to move on down to the abdomen. And at this point, I'm going to go ahead and remove my infant's diaper. If it's a boy, I would be very mindful to do this part quickly. I would probably take off the diaper last as I'm going down my, doing my assessment, because when you take the diaper on and off of an infant, especially a boy, that stimulates the penis and they will urinate all over you. So I'm just going to take it down and I'm going to go ahead and assess the abdomen. So again, I'm going to do like a regular abdominal assessment. I would assess for any a distension of the belly. I would palpate the belly, but I'm going to go ahead and auscultate first. I would assess for any bowel sounds. I would also assess the site of the umbilical cord and where the umbilical cord was cut. Okay, and now that I have done that, I'm going to go ahead and assess the genitalia of my patient. If my patient were to be an infant boy, I would assess the penis. I would assess whether or not they were circumcised or not, but my patient is a little girl, so we're just going to assess her area here. I would assess the testes if it were a boy. I'd also be assessing the rectum of my patient. There's no redness here, no swelling. Everything looks good. Okay, so now that I've got that, I'm going to go ahead and also assess the back and the spine of my patient. I'm going to assess, this is where I can see if there's any spina bifida here. So I would assess that. I could palpate that, and there is not. And the baby's bottom looks good here. All right, so now that I've got my that done, as I was assessing the patient, again, I was being mindful of my patient's skin, assessing for any birthmarks, assessing for any rashes or anything of that nature. And that is it for my newborn assessment. So I'm going to return my baby's little diaper back. Okay. And that is it. Thank you.